Thank you everyone for joining us today for the first Andrea Harris Task Force listening session. We're first going to hear from the chair of this task force, Secretary Michelle Sanders of the Department of Administration. Secretary?
Okay. I'd like to welcome everyone to our listening session and thank you for your participation and taking the time to share your comments and input on very important topics to the residents of North Carolina and the direction of our state. The task force, the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force, was created within an executive order by Governor Cooper, and that executive order was in response to the disproportionate impact of COVID-19 on communities of color. As we all know, COVID-19 has touched and devastated communities across the state and has really touched, I think, every resident of this state and the world for that matter. Yet we are heartstruck by the number of people of color who have been disproportionately impacted by COVID-19. And so the task force has formed, and the mission of the task force, the overall mission is to create economic stability, eliminate health disparities, and achieve environmental justice in North Carolina by convening testimonies such as we'll hear today and input, as well as identifying best practices and ones that we can implement and ones that are actionable, as well as those that we can move forward through policy making and policy shaping, as we recognize that that definitely has a meaningful impact on how we go about our day-to-day lives here in North Carolina and beyond. And so this task force has been appointed by the governor. We have a diverse set of experiences, backgrounds, people, and thought leaders included on the task force. And so they have been working diligently to produce actions that we agree and believe are going to make a difference in the health outcomes, the social, economic, and environmental outcomes for people of color. But in saying that, as you know, as with most things, though it's targeted at the communities of color, the impact and the rewards will go far beyond that and will touch every resident of the state, which is well over 10.5 million. So we do this work with the focus on the disproportionate impact on communities of color, but we also do this work for our state collectively to try to advance those communities to have equity, to eliminate those disparities, as I mentioned, and then to also create some economic stability, which when we lift one up, I believe we can agree that we lift all up. The task force has 5 focus areas and subcommittees. The first is access to healthcare for underserved communities. Second, enhanced patient engagement in the healthcare setting. Third, economic opportunities in business development and employment. Fourth, environmental justice and inclusion. And then fifth, to create educational opportunities for communities of color, not only in academia, general academia, but financial literacy and health literacy. And we are hoping and working towards all the work associated has been identified by these subcommittees. They've identified goals, short and long-term goals, and we believe that this work will definitely have a direct and an indirect impact on the outcomes and the well-being of those who have been disproportionately impacted. And as I stated before, and those other residents who share this same burden and hardship with us. So again, thank you for your time. The purpose of our listening session today is to hear from voices in the community and to hear your stories, your testimonies, your thoughts, and your ideas and your recommendations. And we're excited to also and welcome feedback that may challenge our way of thinking or challenge some of the directions that we are taking as a subcommittee, as that you know best, some of those who are here today to comment because you are the ones in the community's firsthand experience. I think everyone on the task force has its own experiences too that we can bring to the table, but the healthier, richer outcomes will come from your participation and your comments. So thank you very much. And at this time, if there are no questions, I am going to turn it back over to Catherine to tee up to hear from each of our chairs on those subcommittees. Are there any questions at this time? If not, Catherine?
Yes, ma'am. All right, so we're just going to go ahead and introduce each subcommittee chair. Subcommittee chairs, you're going to have about 2 to 3 minutes to just discuss some of the goals of your subcommittees. When you have about a minute left, I'll let you know, and then when we're out of time, I will also let you know that you're out of time so that we can move on to the next subcommittee chair. We'll go ahead and start with Ben Money for access to healthcare.
Yes, thank you, Catherine. Our chair, Dr. Giselle Corby-Smith with UNC School of Medicine, was unable to attend due to clinical duties, so I'll give our report. Our subcommittee actually has some subcommittees working in several areas, the first of which is telemedicine and broadband access, with a goal to increase access to affordable broadband and telemedicine in North Carolina, particularly in rural counties and communities of color. Want to make sure that we are looking at really what the definition of affordable broadband is so that cost is not an issue. Also considering where success is occurring in the state and being able to utilize those models to replicate. Developing partnerships to extend existing grants resources, as well as researching the resources needed to expand access to mental health and maternal health care by telehealth. And then our next committee is on medical home, preventive care, and accountable care communities. What we want to do is identify geographic and economic gaps in access to medical homes, to develop an organizational plan to gain the trust of historically marginalized populations, creating opportunities for people with lived experiences to be involved, as well as addressing the factors of health through healthy opportunities and our use of NC Care 360. We also have a vaccine access, influenza COVID vaccine subcommittee. It is conducting research, creating policy recommendations, and to promote programs that will increase awareness and access to vaccines in communities of color. Conducting market research around messaging, particularly with the influenza campaign and how that can be leveraged to increase engagement in the COVID vaccine. Looking at working with our historically marginalized populations work group at DHHS on linking communication strategies and messages, partnering with the NCOIM and their advisory task force and their committee on COVID vaccine, and assuring that historically marginalized populations are able to participate in vaccine trials and the equitable allocation of vaccines. And then our last committee is around insurance coverage, looking at ways that the state can move away from employee-based insurance coverage, identifying policy recommendations, partnering with other organizations, looking at insurance providers and recommendations around telehealth, and then reviewing existing reports on Medicaid expansion and actionable steps for the creation of long-term goals to support Medicaid expansion. And that is a brief overview of our committee.
Fantastic, thank you. All right, and then next we have for Economic Opportunity and Business Development, we have Representative Yvonne Hawley.
Good morning, everyone. I'm Representative Yvonne Hawley and chair of the Subcommittee on Economic Opportunity. We had a very strong meeting where we had a couple of people who presented. We had a presentation from the Raleigh Chamber of Commerce this last time, trying to tell us what they feel they can do for economic development and what they are currently doing in reference to minority businesses and how they can increase minority businesses. And we also had a wonderful presentation from AT&T being more specific about one of the companies and what they could do. And we found that very helpful. But we too have broken off into even smaller groups to try to get things done in a timely manner. And our subcommittee groups were, the first one is state opportunities for participating in projects at $250,000 or below, consistent with the executive order. This is what you call low-hanging fruit. What is something that we can implement now that's just a policy change or just a procedure that may be done? And we've begun some vigorous discussions on that avenue. The second one is workforce development programs, initiatives for construction trades in the public and private sector. This is talking about job training, what can be offered in the areas, not just construction, but just overall workforce development, what we can do to help hub and underutilized businesses do better. The third area that we've broken off into is the economic incentives for new companies coming to North Carolina. So as these companies are coming up to North Carolina, we want to make sure that, and this committee is going to see about how much Hub can participate in it, because we want to make sure that these companies have a commitment to use minority contractors and Hub vendors in this area. So we're looking into that. Then we got a little bit into our long range goal, which is a disparity study. We have to put things together from a disparity study as being done currently in the Hub utilization of goods and services, and we're going to take a good serious look at this disparity study and know where we need to go from there, as far as what areas that we might need to increase, and where we currently are, because, we need to also know where we currently are. The committee is working very hard to try to move as quickly as we can on some of these, and we would love your input. So thank you.
All right, fantastic. And next we have for the Educational Opportunity Subcommittee, Sonia Richardson.
Thank you,
Dr. Richardson.
Oh, it's okay, no problem. Thank you, Catherine, and good morning. I'm honored to speak on behalf of the Education Subcommittee. On behalf of our esteemed chair, Pat Martinez, the goal of the Education Subcommittee is to create educational opportunities for communities of color in health literacy, financial literacy, general academia, and to make recommendations on strategies to increase funding for health education in community centers servicing vulnerable communities. As a subcommittee, we understand the urgency to provide recommendations for both short-term and long-term solutions that can be implemented immediately, particularly as we are in the midst of health disparities as a result of COVID-19. One of our immediate short-term goals is to host a virtual public roundtable with healthcare and behavioral healthcare leaders, education leaders, and community leaders to understand the impact of COVID-19 on communities of color in our state. The public will have an opportunity to comment on gaps as well that are perpetuating inequities in our communities and solutions for filling these gaps. Our subcommittee is focused on figuring out ways to develop trust within our state, ensuring messaging is appropriate and reaching diverse communities in our state, and also rallying efforts for financial literacy, particularly within public school settings, as well as supporting strategies to implement this. We invite you tentatively to our roundtable that right now is scheduled for October 27th from 6 to 8 o'clock p.m. And our theme is the path forward, addressing education, financial literacy, and health literacy in response to COVID-19. At this roundtable, we will have leaders from financial literacy sectors, health literacy, and education, and more details will be released shortly. And then today, we just want to thank everyone for participating and for your comments. And we believe that feedback from stakeholders will only propel us further in accomplishing the mission and objectives we have as an education subcommittee. Thank you.
Is Cornell Wright on the call at this moment?
Yes, I'm here.
All right. So we have next to speak Cornell Wright, the chair for the Patient Engagement Subcommittee.
Thank you for having me. So Cornell Wright, Executive Director of the North Carolina Office on Minority Health and Health Disparities within the Department of Health and Human Services, where Dr. Mandy Cohen is our secretary and Mr. Ben Money is our Deputy Secretary for Health. Our subcommittee for patient engagement is looking at a few things. And so the input of everyone on this call and beyond is very important. One is making sure, in terms of our goals, making sure that demographic information that is captured across the board is uniform and made in a way that everybody can participate and be seen, heard, and counted. And so one of our goals is to make sure that we have what is called demographic equity, and making sure that people have the right and the option to identify themselves and have this done across the board on all of our health agency platforms, especially when collecting data. One thing that we've seen through COVID is that we are lacking a lot of data from race and ethnicity. And so we want to kind of fill that issue out to make sure that we don't have those issues moving forward, especially in the year 2020 and beyond. We need to make sure we're having good data to tell these stories more correctly and more robustly. We also want to make sure that we are looking at how to improve engagement with patients and health agencies and communities, and have a few ideas around making sure that the work that we do is culturally responsive, relevant, and aware, especially in terms of how we are interacting with the historically marginalized populations and beyond, and making sure that patients have a sense of belonging with connecting to services across the board. Some of our long-term goals actually look at having culturally competent and relevant training for not only people that are in the medical field or in the medical realm, but also those that are coming up through medical and professional schools, so that we can have a better baseline of culturally aware providers and people that are working in healthcare settings and systems. And so we look forward to hearing more feedback about some of the work that we're doing and how we can do it better. Thank you.
All right, fantastic. So from this point, we're going to move to the public comments. I'm going to ask members of the public who have signed up to speak to unmute themselves. Once your name is called, you will be given 2 minutes to speak. I will have a timer, so once your 2 minutes are up, I will just go ahead and let you know, hey, 3 minutes. Once your 3 minutes are up, I will go ahead and let you know your time is over, and then we will move on to the next person to allow for time to not run over for everyone. With that being said, please give me just 1 second and I will call on the first name. I believe we have Joel Porter as the first person. Mr. Porter, are you here?
Yes.
All right, give me 1 second. Let me set the timer. And you may begin.
Great, thank you. Distinguished members of the task force, my name is Joel Porter. I'm a resident of Durham County and the policy manager of Clean Air Carolina. We're a nonprofit, and our mission is to ensure cleaner air quality for all North Carolinians through education and advocacy, and by working with our partners to reduce sources of pollution. Today, I'd primarily like to speak to the latter half of that mission statement as it relates to working with partners to reduce sources of pollution. Clean Air Carolina works within the advocacy community alongside educational institutions and with a variety of partners within the constituencies we serve to protect our state's natural resources. We are ready and willing to work with the task force to offer recommendations to further that goal and create an economy that is cleaner, stronger, more inclusive, and more productive. The North Carolina Department of Commerce should be encouraging a circular, cleaner economy. As the economy reopens, we must strive to build back better. Our climate is changing, and in the lapse of federal leadership, states have been left to fill the void. Here in North Carolina, Governor Cooper's Executive Order 80 aims to do this by setting ambitious goals for reducing climate-driving emissions and creates a statewide budget on greenhouse gases. To stay within that budget, the state should be creating market incentives and encouraging business development that mitigates emissions and helps keep us well below our budget. This effort should begin in the rural parts of the state where economic development is most needed and opportunities for growth are abundant. Instead of encouraging any industry that comes knocking, we should be promoting development that utilizes and reuses homegrown resources and fostering innovation in the most environmentally ways possible. To put it another way, they should be fostering the kind of development that you all would want in your own backyards. Unfortunately, that is not the case. For example, recently the Department of Commerce gave a $500,000 grant to a company that wants to come to our state, cut down our forests, exacerbate already poor health conditions in environmentally overburdened areas. This was the case in Lumberton, North Carolina, where so-called Active Energy Renewable Power, a company with a greenwashed name but is in reality a wood pellet manufacturing plant, has been approved to begin manufacturing just last month. There are a whole host of high-polluting companies like AARP that have come into our state. If this kind of development continues, these businesses will bust through our greenhouse gas budget like a hammered glass. Prioritizing environmentally friendly development should be the top priority of the state's economic development plan. Doing so will improve community health, create valuable employment opportunities, and will keep us within our greenhouse gas budget. Clean Air Carolina stands ready to work with
Mr. Porter, your time is up. Thank you so much, sir.
Thank you.
All right, and we're gonna go ahead and move on to the next person. Is Nicole Karim on the call?
I'm here.
All right, fantastic. Miss Karim, your time starts now.
Well, good morning, Secretary Sanders and distinguished members of the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. My name is Nicole Karim, and I am the policy liaison for the North Carolina Healthcare Association, whose membership includes over 130 hospitals and health systems across our state. NCHA believes in a North Carolina where high quality healthcare is equitable and accessible for all, and strives to improve the health of the communities where we live and work by advocating for sound public policy and collaborative partnerships. NCHA appreciates your leadership to advance health equity so all North Carolinians can have accessible and affordable healthcare close to home. I'm here today to address one of the task force's recommendations under access to healthcare, which is to increase access to broadband and telemedicine, particularly in rural counties and communities of color. Aside from the convenience many of us have personally experienced over the past 6 months, the benefits of telehealth expansion are clear. Increased access to specialists, eliminating barriers to care such as lack of transportation or lost wages, improved engagement with the patient's family or other natural supports, and especially for patients with a behavioral health diagnosis, decreased no-show rates. There is so much promise for further expansion of telehealth and the innovations accelerated by the COVID-19 pandemic. We appreciate expanded telehealth afforded by the public health crisis, but telehealth coverage in North Carolina is not protected by state law. In fact, North Carolina is one of 8 states that does not have laws protecting patients' rights to telehealth services. In the absence of legal protections, patients are at the mercy of what payers choose or choose not to offer in their benefit plans. We believe this is a necessary first step to guarantee telehealth access across our state. As you all consider tactical strategies necessary to move the needle in health equity, NCHA respectfully requests the task force consider recommending legislation to require all health insurance payers to cover telehealth services and require payment parity for providers to ensure clinics can sustainably offer telehealth services in their communities. Thank you for the opportunity to address you all this morning, and we look forward to working together to improve health equity in North Carolina.
Fantastic. Thank you, Ms. Karim. Okay, we're going to go ahead and then move on to Harold Kudler.
Yes, hi.
Hi, Mr. Kugler. Give me just 1 second. Let me set this up, and your time starts now.
Yes, good morning to the panel. I'm Dr. Harold Cudler, a member of the North Carolina Psychiatric Association and of its Health Disparities Work Group, which we set up very early in the COVID crisis. We're pleased to have this opportunity to provide comments, and we'll start with respect to access to healthcare subcommittee. We want to raise concern that while improving broadband is important, it won't be enough. Many of the patients we serve, including inner city people, as well as people in rural communities, lack the hardware to receive or send health information via broadband. So it's going to be important for our patients, as it is for our schools, to provide access through the right equipment at the end user level. Also regarding end users, efforts should focus on allowing health platforms to be maximally accessible for those with lower technology literacy. The rigors of HIPAA compliance, state regulations, and other important kinds of rules and regulations also need to take in consideration the need not to overwhelm the capacity of the end user. We have people at different levels of education, different levels of technical expertise, and we can't lock them out even as we open up the airways to their comments. When it comes to educational opportunities, we found that it was unclear who the target audience for this education would be. Would it be the community at large, patients in particular, families, the medical community? Would it be clinicians or administrators? So we'd like to see that made more clearly. Also, are there other ways to engage the community through its natural networks, such as schools and churches, food banks, et cetera? We hold up El Futuro, which does such a good job of connecting with the Hispanic community through natural networks that exist in that community, rather than trying to create artificial ones, which tend not to reach as deeply. And finally, we'd like to recommend that the Institute of Medicine become a full partner in this process as you move forward. They have a unique ability to synergize the best in science and clinical systems, in public health, and particularly legislative expertise. So in the past, in dealing with various crises and longstanding situations across the state, we found the North Carolina Institute of Medicine to be a remarkable partner, and we didn't see them mentioned. We'd like to point out the potential value of that, and that's where we stop.
All right. Fantastic. Thank you, sir. Okay. And then next we have Miss Yassine McNeil. Okay. So not hearing that. Ms. Joan Bean, are you on the call?
I am. Good morning, and thank you. Good morning. My name is Joan Ben. I'm the president and the CEO of Living Waters Incorporated. Thank you so much for allowing me to be able to provide comments today. And I'd like to focus my comments regarding access to care, patient engagement as it relates to mental health. Disparities based on culture, race, and ethnicity impacts the delivery, the quality of care, as well as outcome in mental health. Communities of color require targeted outreach and engagement strategies, along with treatment and services that are tailored to their background, their families, and communities to help them improve their mental health. And so, now we recommend, as the committee is reviewing their plans and their strategies, to really consider programs, resources, funding for the purposes of a targeted approach or a cultural approach when it comes to mental health. There really needs to be an understanding of the cultural nuances of the stigma and discrimination in minorities, especially in the Black communities, and to be able to determine the best approach to mental wellness. There needs to be a harnessing of the power of the faith community, which in many ways for communities of color, Black, Latinx, they're the gatekeepers, they're elders. And so we really need to collaborate with the faith communities and our faith leaders in many ways for delivering messages of support, education, and hope. Um, and that we feel that is the most effective way to address stigmas, especially in the communities of color. We really need to would recommend that you bring together faith leaders, consumers, and their family members, mental health providers, and community organizations to create a shared wellness environment, something sort of like a mental health friendly environment. Needs to be community dialogues and wellness fairs to support minority communities and just to help them talk about their issues and learn to come up with tools to way to address that. And there just needs to be a platform that's established, that's funded, that's resourced, and supported by all the stakeholders involved to help communities of color overcome and bridge some of the barriers that actually impede them from wanting to come out and share about their challenges concerning mental health and emotional wellness. So thank you for that. Now, I think I'd like to end with the last slogan is what we need to do really is go where the people are rather than asking them to come to a mental health center. And that's going to help them. Thank you so much.
Fantastic. Thank you so much for your public comment. Last, we have Miss Sandra Wilson. Are you on the call?
Okay. Yeah, my name is Sandra Wilson.
Okay, you may go ahead and speak and give your public comment, ma'am.
Okay, about the people of color. I'm to give a comment on the program of what? I don't know much about the program. I just pulled that from the internet because it was there and I read it. And there's not enough in there really to give a comment. Are we commenting on the needs of the people in the community or the disparity with the health situation?
Oh, yes, and thank you for joining. So we are welcoming comments on both disparities that are in our community as well as improvements
in the community. Like if you've been a provider for 20 years, the disparities in the community, the people have barriers in their transportation and they can't get to the location. But most people of color don't have it on their contract to provide those services. They're most often given to the largest providers. More services are most often given to the largest providers, being HRA and other big services and services that come and be accredited from other states. So
yes, ma'am.
I can't serve the people in my community because it's not on the WB's contract. And I've been here 20 years. Mm-hmm. The people know me in the community. I know their needs, but it's not on my contract. Okay? Another thing is when people get their prescriptions filled in this community and the psychiatrist see them, they don't have the money right away to get the prescription filled. And they end up being in the hospital waiting to do without the prescription. And then they get real sick, and then they have to go to the hospital and stay 4 or 5 weeks to a week to stabilize their health condition. When just having the money readily available to get prescriptions and having access to care where transportation is a barrier. I don't have that option, and I'm a person of color, been in business for 20 years, and I still don't have stuff on my contract that would help me meet the people.
Right. Okay. Thank you very much for your comments. And so I think what I heard, just to restate, is that there's barriers to providing transportation to people, and also the lack of support and funding that people may need to actually get their prescriptions that are prescribed. Because of that, it leads them to have a hospital stay. I think that's what you were describing, ma'am.
Okay, here's what I'm describing. There's barriers to contracts. They put what's on your contract so you can halfway serve the person. And then you have to send him to another provider, which is 30 or 40 miles away. So if they don't have transportation, they can't get there. Why can't it be put on the contract and you could serve the person in their community? And they wouldn't have to worry about transportation.
Okay.
That's the issue. Contracts is the issue, and being discriminated against, not having these contracts on your service from the provider.
Okay.
Do you hear what I'm saying now?
Yes, ma'am. I hear you saying that there's barriers to getting the contracts to include what we need them to include and be to be able to serve the people in the community beyond what some may think is important, like adding transportation into the contract.
No, transportation is one of the barriers, but for a person to be with somebody 2 or 3 months, and you see that person making progress, and they go to another provider, they're used to another provider, and they made a relationship with them. So you can't serve the people in your community because the funding is not on the contract. It's other. That's just it. I don't have a whole lot. I don't have a whole lot to say, but they disparity in giving contracts to certain providers.
Apologies for the interruption, Ms. Wilson. We are out of your time and we need to begin moving on. I will send you, since I have your email from when you signed up, I will send you the link so that you can type in your public comment onto the Andrea Harris Task Force website, and we will fully review that and send it out to all of the task force members for review and to take a look at when we are giving all of our future recommendations for this year. Thank you so much for giving your input, and thank you to everyone else who has given their input and your public comments for us. Secretary, we are going to go ahead and move on to the next part of this. And once again, I can also, to all the members of the public who came and gave public comment, I will also link you the link to give more public comments on the website so that the rest of the task force may hear anything else that you have to say.
Okay.
Okay. So, Catherine, I believe that wraps up all the comments that we have, and we'll move forward with closing out, correct? So I'd like to thank everyone who took the time here today to comment, and definitely Mr. Porter and Karim and Mr. Harold. I know I'm calling some of you by last name, some by first name. And Ms. Wilson, thank you so much for your comments, and it's greatly appreciated. As Catherine mentioned, she will send you a link, and Ms. Ben, she will send you a link to including additional information you may have. We recognize this was a limited time, but I know that I learned some things, and I'm sure the rest of the task force did as well from your comments. And so what I will commit to you is that we will consider your comments. As you know, no one has that magic wand to say that we are going to correct and going to do all these wonderful things. But I think the most important thing is to be candid, upfront, and truthful in that we will consider your comments as we go about this work. That's why we had a listening session, because it is so vitally important to hear from you. So thank you very much. Our next listening session takes place at 5 p.m. on September 29th, and that will focus on environmental justice and inclusion. Mr. Porter, that sounds like one that you may be interested in joining us again as well. Members of the public can also provide feedback on the Department of Administration's Andrea Harris webpage, public comment, which Catherine mentioned. All of our Andrea Harris Task Force meetings are public, and the upcoming dates are also published on that website page, so you are welcome to join. On behalf of the task force, I want to thank you again for providing your feedback as we work together to create a more equitable North Carolina and to eliminate social, economic, environmental, and health disparities. I believe if we do this, we can also create, hopefully, an economy that will help everyone thrive in this state, and also have a state that is welcoming and that truly we're able to see a difference not only in the topics we discussed here today, but on all the other topics as well, as such as climate and environment and all the things that I think we care deeply about for ourselves, for our families, and for our future. So thank you very much. Are there any comments or any questions at this time, or anything from our task force members who are also on the call listening? Okay, well, thank you all very much. Please follow up with the additional info if you did not have sufficient time, and everyone stay safe during this time of COVID-19, this pandemic. Please remember to wear your face mask, wash your hands frequently, and wait at least 6 feet back. I see our task force member, Ben Money, has that as a background as we do the things that we can do to protect others as well as try to protect ourselves and to help put this virus to rest as we all want to get back to some normalcy, though I think where we are now is probably the normalcy. But thank you all very much. Before I get off, I would also like to remind everyone that we have an important engagement that is going on right now to the state, and that is Census 2020. I ask all of you, if you have not participated in the census, to do so. The last date to do that is September 30th. The census is important because it will be the way to determine the distribution of federal funds to this state and to our communities, as well as there is a possible apportionment of another seat in Congress. Right now, with our census participation, we are putting at risk $7.4 billion a year in funds that would be used for exact conversations that we're having today. And so the services are needed. We've already paid into this through federal dollars and state dollars. And it is vitally and critically important. It takes 10 minutes. It's safe. You can do it from home on your mobile app or the mail-in, or you can call. But please complete the census. It is of great urgency, and it is of critical importance to every resident of the state. Everyone can complete the census, regardless of who you are, where you live. Complete your census. Thank you all, and have a very safe remainder of this time, and have a good day.